What's up, guys? This is Dr. O from Innovative Dental, and I'm smiling because we're trying to still be happy during probably a more challenging time for everybody here. But you know, COVID-19 has kind of put a kind of a damper across our country as far as you know, obviously illness and everybody being able to get out of the house. And I know a lot of cities and states have mandates in effect that affects every aspect of your life. And so we wanted to address the dental concerns and dental health and make sure that we got some word out about how people should handle their oral health conditions. Our city is a little bit different than maybe yours, but I wanted to go ahead and define what dental emergencies are and then give Amanda an opportunity to show communication techniques with your dental office should you have anything you want to show them intraorally, or your dentist being able to email them. So hopefully this is a little bit helpful if you are concerned about maybe a dental visit or you have some decay or pain during this. For us, they said 30 days. Some people I've seen even longer. So let's go ahead and talk about that. I wanted to bring up what the ADA has defined. If you're under an ordinance or a mandate that says you can't, or you're only supposed to go out for emergency only dental treatment, it might be easier to say what's not emergencies. You're supposed to reschedule your regular visits for exams, cleanings, and x-rays. And I'll link to this, by the way. It's mouthhealthy.org/virus. And it basically just gives patients a good rundown of what they should be doing in response to this if you have you know, emergency only treatment or elective only treatment mandate in your city or state. Springfield is where we're from. They've chosen to still encourage people to take care of their oral health, and I think that this is more restrictive. Some states and cities, they've said just only on emergency. So that's why we want to bring some clarity for the country when it comes to their dental visits there. So regular visits for braces, you don't need to go to those. Removal of teeth that aren't painful, treatment of cavities that aren't painful. So basically they're just wanting you to, if it's not hurting you, you know, hold off. And then tooth whitening. So that kind of sums up the things that you know, don't go for. Everything else as far as pain, I think they have a few things like gum infection or pain or swelling, bleeding obviously, biopsy of anything that you feel like is abnormal, snipping, adjusting wire, braces, and hurts your cheek or gums. Those are still things that they'd like you to address. So Amanda, let's show them briefly how to, if you have a concern or a problem and you're wanting to communicate with your dentist, you know, I'm sure every office is going to have, I know we do, we have ability for you to text to us and also send us emails. And so when you do that, you're obviously going to be like trying to take your own photos, and probably it's going to be a little difficult. So if you have, hopefully maybe plastic spoons are probably going to hurt a little less because it can be a little uncomfortable, but you really need somebody to help you with this. I think it's pretty hard to do on your own. But Amanda will show you this cool technique. I don't know how cool it is, but it'll show you how we can still see your teeth and you have somebody help take a photo. So
yeah, so you're gonna get your spoons, turn them.
There you go. Oh, I might want to turn my camera on, but you know, it's just for effect, right? So there you go. Perfect. Oh, I can't wait to put that in the video, man.
I'm not
that
looking
looks good.
forward to that.
That looks great. That's perfect.
Oh boy.
Well, anyway, so hopefully this is helpful for those that are maybe had some questions about their dental health and dental care during this time. And we all are praying that this is you know, over sooner than later. And we wish everybody the best. Thanks for watching this, and maybe share it with, you have friends or family that are going, you know, I've got some dental visits or some dental problems. Hopefully this brings some clarity. And you know, we'll see you in another video. I'm going to post a smile of the week, which would be a little bit more upbeat and happy. Obviously, we want to share some things that are obviously still positive in this world, and that's obviously creating smiles. We love doing that.
Absolutely. And
we'll get back to doing that pretty soon. So I know those that are maybe traveling, we've been having to put you off a little bit because a lot of it's cosmetic. So you know, I'll hopefully be able to do virtual consults. So if you're wanting to go to that, it's yoursmiledestination.com, yoursmiledestination.com. That's a little shameless plug while doing this video. Why not? So anyways, you guys have a good one. Keep smiling. It looks good on you.
I don't feel right in the daylight, spending all my nights on the dark side. Somebody help me find a way to get back home.